wonderful board member Karen, who is here today, and I'll let her introduce herself in a second. But I'm super happy to be here. I can tell you that I am just old enough, actually talked about this on a Facebook post yesterday about how 20 years ago when Matthew Shepard was murdered, I was inches from being out of the closet and figuring out myself at 20 years old as a college student. So I'm relatively late bloomer, but still old, just old enough to where walking into medical care as a openly gay teacher and as an openly gay person has always been a source of fear. One story I'll share with you real quick is my wife and I were married in California in 2014. And then I accepted a GA position at UT with the College of Education to work on a doctorate. Decided to move here. My wife is from Toledo. I'll just answer that question now. I know that's gone through your head. Why did you move from there to here? That's the number one question I get all the time. But she's born and raised in Toledo. She graduated from Whitmer and then bailed and hadn't been back. So we're here to be close to her family. So that aside, accepted the GA position and moved here. And at the time, our marriage would not have been recognized in the state of Ohio. And so we were making plans on lots of legal documents. Thankfully, I have lawyer friends in California from my undergraduate, so they were helping me and us to prepare these documents so that if something were to happen to me or her once we moved here, that we had some sort of protection that we could fight for. And one of the scariest things is in case of emergencies, in case of medical emergencies, would I be able to enter a hospital room and give care and be the person who makes decisions for my wife and vice versa. We don't have kids, so that was one less complication, but it was very scary. And then June of 2015, right, a month before we were set to drive across the country, the Supreme Court, federal Supreme Court, told all states, you have to recognize legal marriage licenses. And we still had problems moving here, actually, with our health insurance, with my wife's health insurance, who said, oh, well, we think you have to get married here in Ohio because we still can't accept your kid. It was a thing. So I can tell you that any question that you have today, I hope you will find this a completely safe space. You will not insult us, and I'd frankly rather you insult us now if you think that's going to be the case than when you're faced with someone who's in crisis and having to ask some questions and not knowing how to navigate that. With that said, because this focus is on transgender care, particularly who come through your doors, we're very lucky in our board to have such an esteemed speaker and someone who's willing to share so much of her life story in Karen. So I'm going to give this to her and kind of sit back and learn some things myself, quite frankly. So, thank you. Yeah, no problem.
Turn the mic up. By a show of hands, how many of you have ever met a transgender person? Holy cow, that's awesome. So how many of you have, you know someone personally, a friend, a family member, who's transgender? Even better. Okay, awesome. How many of you met a celebrity before? Okay. Well, the rest of you can cross that off your bucket list because, as Annalise said, my name is Karen Marie Vaughn. I'm an author and advocate. For a short time longer, I'm a board member of Equality Toledo. I am a former U.S. Marine. I was a volunteer firefighter for 10 years. And my family and I were showcased on TLC's show, Lost in Transition, that aired this past May and June. I'm also a transgender woman, so if that wasn't on your bucket list, you can cross it off too. What I want to do today is just talk to you about dealing with a transgender patient in the emergency room or in your practice or while you're moving along in your career. I think the first thing we probably want to talk about is the use of pronouns. It's very, very important, especially for someone who might be gender fluid or non-binary. For myself, I prefer she, her, and hers. For someone who would be a transgender male, they might prefer his, him, and he. Someone who's non-binary is going to require, not require, but prefer, I hate using that word prefer too, they, them, and their. A non-binary, do you know what a non-binary person is? By any chance? Anybody know? Okay. A gender fluid and non-binary person are considered transgender, but they may feel one day they are more masculine than feminine, and then the next day more feminine than masculine. A gender fluid person actually crosses over that boundary back and forth. Some of them might prefer to wear androgynous clothing or have androgynous hairstyles, so it makes it easier for them to go from being a boy and a girl, or vice versa. Someone who is assigned male at birth, such as myself, and in transition is considered a transgender woman in transition. Someone who's assigned female at birth and is transitioning to male is considered assigned female at birth. The best way I can tell you how to describe someone who's transgender is we popped out a mom with the wrong starter kit. Myself, I knew when I was 11 years old that I was not the person I was supposed to be. I felt I was a girl. I told my parents I wanted to be a girl, but raised in a Roman Catholic family back in the early 70s when being transgender wasn't a coffee table topic that it is now. My parents did the only thing they thought they could do. They went to the church. Regrettably, that didn't end well for me. I spent a year in what is considered conversion therapy. For me, it was more along the lines of sexual child abuse. I was required to kneel naked in the priest's rectory while I recited Hail Mary and Our Father. He walked around me beating with a wooden stick or leather straps until either I couldn't pray anymore or I fell over, at which point I was sodomized. I was told to keep this secret, not to tell anyone. What he was doing was saving my soul, and if I told anyone, I would go to hell, and so would my parents. For 40 years, I held that secret. I never told anyone. Somewhere between the early part of my 6th grade year, this happened in the beginning of the 5th grade year, my parents suddenly pulled all of us kids out of Catholic school and sent us to public school. I never said anything. My parents never said anything, but I think they may have found out or had a hunch. For me, it was probably the most gratifying moment in my life that I no longer feared going to school, but I had learned to not trust adults. I had given up my faith in God. I lost my self-esteem and my self-worth. And from that moment on, I had one goal in life, not to wake up the following morning. I graduated from high school and immediately joined the Marine Corps because I was too chicken to kill myself. They had just taken the embassy in Beirut, and I figured I'd be going off to war, and it would be real easy for me to stand up and step in front of a bullet. I spent 12 years in the Marines, did everything I could possibly do to put myself in harm's way. Became a helicopter crew chief, a search and rescue crew chief, a search and rescue crew member, a combat SAR member. I deployed to Beirut, and I survived multiple aircraft crashes. Unfortunately, Marine Corps, well, I can't say unfortunately, they didn't succeed in the goal I had set out. I left the Marines to get a college education to try to return as a pilot. Yes? Thank you.
I'm so sorry for what you went through. Make you so sorry.
Thank you. I got married in 1995. It's actually my 3rd marriage to a wonderful woman. it's going to sound strange, but I was in that point in my life where I felt my biological clock was ticking down. I wanted to have kids, and there was no way for me to have kids. The only way for me to do it was to find a woman and get married and have kids. I had that motherly instinct, and I know I get a lot of harsh comments about that. How can you do that? You're not a girl. I can tell you that it was exactly the way that my wife had described it to me. I needed to have a child. I needed to be a parent. I wanted to be a mother, but I knew I couldn't be. So I had to force myself to take that role of a father. We had 2 wonderful children. They're both adults now. One's currently a sophomore at BGSU, youngest one. The oldest one is non-binary. Cass came out the same time I did, basically, to one another. It was the morning after the elections in 2016. Unfortunately, Cass lives on the east side of Ohio, about 10 minutes from Pennsylvania, in what is considered strictly Republican country, and everybody voted for Trump, and they had actually left rude and very disgusting words on their house, on their car. They had been harassed. They'd been accosted with guns. Cass actually felt that they were going to be killed because they were rioting or celebrating in the streets, and they were celebrating out in front of their house. Cass confessed to me that they were transgender, non-binary, and for the first time in my life, I was scared for my child. I knew what they were going through. I had felt that all of my life. I had been beaten up a few times as a kid, been harassed. I had been bullied. I never felt secure enough in telling anyone how I felt about being a girl, how I felt that this was wrong, how I needed to change. When I was on the fire department, I responded to a call where a girl had hung herself with a dog leash. And it affected me pretty bad because the night before, less than 12 hours before, I'd actually seen her down at a pub on Monroe Street. She was on a dance floor dancing with her friends and having a good time. Real pretty girl, probably about 21, 22. I remembered her because I loved her earrings. They were gorgeous, one-of-a-kind, dangly earrings, and she was still wearing them. We worked on her. She was deceased. It was a Signal 18. I couldn't get that out of my head. I had that voice inside of me. The girl inside me kept telling me, we have to do this, or you're going to end up like her. I tried to drink away my feelings. I tried to shut myself down, but I couldn't. And a fellow firefighter had mentioned this to the chief. And the chief said, you need to go see the psychiatrist, the department psychiatrist, before you can get back on the truck. So I went to go see him. I saw him for 3 sessions. In the 3rd session, I asked him, what I tell you, is that confidential between you and I? And he said, yes. I said, I don't know what the word is, but I've always felt I was a girl, and I wanted to be a girl. And his reply to me was, I'm going to put you back on the truck. You're gay. You're going to have to deal with it. And this isn't something that I handle. That was the first medical professional that I'd spoken to about being transgender. I spent probably the next 2 or 3 years building up enough courage to try to talk to someone again. In 2016, I had come to the point, the end of the road really. I had decided I couldn't live like this anymore. I didn't want my family or friends to find me. I've seen so many suicides being on the fire department. The mess that has to be cleaned up, the trauma to those who survived, the questions. I could never come up with a method that wouldn't cause my family or my friends a great deal of harm until it suddenly hit me. I would just take my four-wheel drive truck, go down to the lake, and head off towards Canada until I fell through the ice. So I drove my truck down to the lake out at Oak Harbor, I think it was. There's a beach out there. And I drove to the edge of the water, and there was a 30-foot gap between the water and the ice. I couldn't get on it. I made one last final call and found a therapist in Maumee who had actually dealt with transgender issues and gender dysphoria. And she made an appointment for me. I went over to go see her, and for years I thought I was mentally crazy. I always had three lives I thought I was living. The girl, the boy, and the man who was trying to protect all of us. She told me, "You're not crazy, you're not mental. It's a biological condition, and you have gender dysphoria. You're transgender. You need to transition." That was in September, early October, probably November, that I started seeing her. And by the end of January, I believe it was, I started HRT a few months later. I've been on HRT since January of 2017, like the 28th, so I technically call it February. This is all natural. There aren't anything fake or whatnot on it. This is just me, straight up. I've never had to deal with going to the ER as a transgender person yet, knock on wood. In March, I will have my bottom surgery. I'm anticipating I'll be probably in and out of the hospital a lot with revisions and follow-up care. But speaking with other transgender women and men who have gone through the same process that I've gone through, they all tell me the main reason they don't go to the ER or they don't go see their doctors, they feel they'll be humiliated, ridiculed, laughed at, turned into a circus freak show, and they would actually forego going to the ER or calling 911 if they were having a heart attack. That's got to stop. So what you need to do, or what you should do, or could do, is to help alleviate that sense of hostility that a transgender person is going to feel when they come in the emergency room. The best way for you to do that would be to introduce yourself with your title, your name, and use the pronouns that you use. She, her, hers, he, him, his, they, them, their, and then ask your patient, which pronouns do you use? Try to avoid that word preferred. For a lot of transgender people, preferred means you don't really understand us, or you're just implying that you think you know what's going on, and it makes them feel instantly that you don't believe that they're transgender, you don't believe that I'm actually a woman, or there would be a transgender man, that they're actually a man. By doing that, you're going to take away any of that, what's the word I'm looking for? Apprehension that they'll want to open up to you. Because they absolutely do need to open up to you. We are on medication. If we're transitioning, we are on medication. Myself, I'm on estrogen and spironolactone. We just shorten it to Spiro. It's an anti-androgen. Lowers my testosterone. The estrogen raises my estrogen. There are other drugs that I'm on too as a result of taking those two drugs. I take a medication to lower and maintain my potassium and to monitor my blood pressure. I also take some medication that helps me to not put on weight because the Spiro will add weight, will make you gain weight. The estrogen and one of the other medications act as will either act as a clotting agent if my level's too high, above 1,000, or the blood pressure medication that I'm on will actually thin my blood, which creates a problem when I go into surgery. I have to stop taking my HRT regime about 6 weeks out, so if there aren't any complications in surgery. So if I show up as a transgender person in the emergency room and I need an emergency appendectomy, you're going to want to know that information. You're going to need to make your patient comfortable and feel like they're not harassed or going to be humiliated so that they disclose that information to you. You don't want to learn that on the operating table. Also keep in mind that, and I hate treading into this water here, but please try to keep your religious beliefs to yourself. It's okay that you think either way, but if you start giving the church talk, you're going to lose that patient, literally lose them. 80% of the people who are transgender have contemplated suicide. Of that 80%, 41% of them have attempted it at least once. The 41% who have attempted it, 70% of them succeeded on the first try. Those are high numbers. In relative comparison to the general population, every 8 transgender people for every 1 person in the general population dies of suicide. There are 1.4 million of us, as a survey taken in 2016, who are out and proud, and an estimated 2 million more who are either in hiding or being forced to be in hiding for fear of being or retribution. Right now, it's a very dangerous time to be transgender in America. Our rights and liberties and health care privileges are being stripped away from us. That's about all I can tell you up front. Just treat your transgender person, your patient, as a person. They're no different than you or your loved ones. They do have some unique medical needs. In particular, if they are on HRT and if they don't need surgery, they may have not brought that medication with them. You want to get in contact with whoever their endocrinologist is or their physician who is prescribing them their HRT medication so that they have that. To go without our medication for an extended period of time, 6 weeks is pushing it. We begin to regress. We won't go all the way back, but we will start to lose the progress that we've made. To restart that again only means that if we did it the first time, we'd probably go that far. If we stop and start again, we're only going to go that far. If we stop and start again, we're only going to go that far. It's a crutch. If we have to stop our HRT, we've got to keep taking it. Otherwise, we won't progress. I would imagine most of your patients are going to be adolescents. There are a lot more teenagers, a crowd underneath 20, 25, who are transgender now and coming into the emergency room. The older crowd, such as myself, there are fewer of us than there are of the younger crowd. So you're probably going to have to deal with a certain set of guidelines and medical conditions, dealing with an adolescent who's on HRT as opposed to someone who's over 30, over 40, over 50, as in my case. Any questions? Anything that's on your mind or that you want to ask?
Any place in the Midwest where they do the operations, or do you still have to go Canada or California?
There are a lot more places in the United States that are actually doing the operation. I'm having mine done in Pennsylvania. I was scheduled to have it done at the Cleveland Clinic in April, but when we were shooting the show, I did a Skype interview with Dr. Kathy Roomer in Pennsylvania, and I didn't know that she had actually put me on her list. She called me in August and said, hey, get your letters in here. We can get you in before Christmas. That's another ironic thing. I went and got my letters. I sent them to her, and she said, these aren't going to work. The WPATH Standards of Care, the World Organization for Transgender Health, requires 2 letters for me to have surgery, or for a transgender person to have surgery. And there's 28 questions that they have to answer. And these 2 letters have to come from someone with a medical degree of a master's or better, preferably a psychiatrist, and or a therapist that you're seeing, and or endocrinologist or a doctor who's treating your HRT. My therapist got hers corrected and back in time, the second time. My psychiatrist I had to go and see. She omitted 1 question by accident, and it got kicked back, and we had to do it again. It took me 2 months to get those letters into her, and by that time the window had closed, and I lost the opportunity of getting it done by the end of the year. I was hoping for a Christmas present. So they put me on the list for March, and I'm like number 3 on the list, so I'm hoping like maybe the first or second week of March I'll be in, get it done, and I'll turn my Audi into an innie.
There is someone at U of M that does take care of trans care as well. So Ann Arbor is close to the Science School Clinic.
There's a multitude of doctors in California, in New York, Chicago. It just depends on where you're at strategically within the U.S. and what your insurance company will cover. Yes, luckily I retired from Chrysler. I built Jeeps for 32 years. And I retired in September of last year, 2017. And I didn't know this, but I had to transfer over to the retirement plan, the medical plan. And the medical plan covers 100% of transgender care, including surgeries. So I was like, okay, literally dancing in a kitchen, because it was the surgery. My bottom surgery would cost somewhere between $50,000 and $80,000. It's not cheap.
For legal purposes, do you get a new birth certificate?
State of Ohio will not grant a new birth certificate, but they did change the sex on my driver's license, which is a bit of a shock to me because I got caught in one of those sobriety checkpoints. I wasn't drinking, just driving home. And I handed the vehicle registration, proof of insurance, my driver's license to the state trooper. And they were sticking their heads in the car and asking me all questions and sniffing for booze and everything. And the trooper walked up and he did one of these things. He says, "Do you know that you're a female in the DMV records?" And I went, "Really? Well, that's way cool." And then I had to, because at that time I wasn't presenting as a female yet, so I had to pull out this letter my endocrinologist had given me that said I was, in transition, and I would sometimes look like a boy and sometimes look like a girl, and it was all legal and whatnot. So they had sent off a letter to the Department of Motor Vehicles, and they changed my driver's license for me. Kind of freaked me out too, because then the state trooper said, "Well, I'm going to give you a warning. You're in the system now. If you get pulled over again, we're going to confiscate your driver's license and we'll tow your truck." So you're going to want to don't go down to DMV and get that done. And I was like, oh, wow. Well, I had to like, literally bum rush my name change. I didn't want to pay the $50 fee to do it twice. So I was like walking on glass for 2 months while my legal name change was going through so I wouldn't get stopped again. I never went back out again. People asked me to go out and I wouldn't go out. I'm staying home. So.
The state of Ohio is one of 2 states left in the country that does not allow for birth certificate name changes. But there is a current lawsuit at
Yes.
the state level that is trying to change that. So hopefully it'll be struck down within the next calendar year.
Hopefully.
Yeah.
Next.
Do you feel that now, like at this point in your life, do you think it was easier coming out and like, to me it's terribly sad that it had to take so long, but I feel like you said, you came from a population of people where it was very challenging. You yourself was saying how hard it was even 20 years ago, and dealing with my own family and, you know, having gays and things like that, seeing my uncle deal with the behaviors he had to deal with then versus now. Do you feel like you're at a point in your, like, I guess, I don't even know how to word it, like, do you feel like now it's just, there's like a piece about it, like where you're not more comfortable than when maybe 30 years if you would have done it, or do you wish 30 years ago that you could have then?
I don't have any regrets. I should. There are days when I think I should. Once I started HRT, I would say within a matter of days, probably within that first week, I noticed the mental changes. I noticed that, hey, I would go to work. I was still working at Jeep. And about a month into it, people were coming up to me and say, hey, you know, what's wrong? You look different now. And I'm like, I go, what? I go in the bathroom, you know. And I was like freaking out because I was like, you know, what's going on? But I noticed it myself about a month later. I was smiling again. Every picture I had from the time I was a little kid to I was in my 50s. I got to 50. I had this really depressed look on my face. I had big bags beneath my eyes. I looked like an old, grumpy old man. And I was just sad all the time. But now I was smiling and I had cheeks. I was swiffering my floor in the living room, and my wife had this giant mirror in the hallway, in the foyer. And I was swiftering by and I was dancing, and I walked by it, and I went over this way, and I stopped, and I went, what the? I walked back over, and I looked into the mirror, and I could see that my face was beginning to change. It was starting to look more feminine. Like, I know it still looks masculine, but if I showed you a before picture, you would go, no way. Okay. I had cheeks. I was smiling. I was happy. And I started to notice that I was happy. I wasn't thinking about dying. I was actually looking forward to waking up in the morning. I had all of my life, as a result of having to suppress my femininity, chewed my fingernails down to the wick. I had the ugliest looking fingers in the world. I would literally chew them down till they bled. And I never felt that need to put my fingers back in my mouth. I tried everything, that stupid stuff to paint on there that burns your lips. Only turned me on to jalapeno peppers. Did not solve the nail biting thing. After I started HRT, I have yet to put my fingers in my mouth and chew them. These are actually my real nails, and when they started to get up to the tips of my skin, I started freaking out because I started feeling something I never felt before. Fingernail on top of the tip of my finger, so it was a whole new sensation for me. I did notice a few other things. My skin got softer. I was never really the kind of person who could grow a beard or facial hair. I'm kind of blessed in that aspect. I know a lot of transgender women who have to go through electrolysis. I did it on my upper lip because I had a little bit of hair up there. I can tell you that it's horribly painful. It's like getting stung 1,000 times with a wasp. I wouldn't do it again. And one of the other reasons why I decided to go with Dr. Roomer is because the Cleveland Clinic wanted me to do that downstairs. And all I could think about was, holy cow, I didn't think I could endure that pain. So I don't think there's enough pain medication or numbing agents to want me to even try that. The next question.
Are there any questions that you have? I'll have some best practice. I'll close up with some best practices recommendations for you all to consider, but are there questions that you have for myself or Karen that can help you in the moments that you do have a transgender patient in front of you? Please.
Okay, so if we do say or do something that is upsetting, how should we respond to it? And my example is in triage, I have a transgender person listed as female, presented as female, looked female, and so then I asked, when was your last menstrual period? And, well, I don't have them. Why don't, what's the reason for that? And if they are offended, what this person was not. This person said, well, I'm transgender. But what would be the best way to react so as to not, or to diffuse it?
I'll let Karen take the bulk of this, but I will say, Karen and I presented for, we were on this campus for another group of, a cohort
Yes,
of.
PAs.
Yes, PAs, thank you. And I shared a story as a cisgender, and cisgender is the term for someone who identifies as the gender or the sex they were born with. As a cisgender female, I've had issues with that, where I had a OB screaming at me about not taking birth control even though I was sexually active. How are you keeping from getting pregnant? Let's maybe ask this question a different way. I'm a smart aleck, so last time I checked, my girlfriend can't get me pregnant. So she turned red, left the room. That was that story. But my point being is that it's not even necessarily a transgender question because you may have a cisgender female. My suggestions coming from the cisgender point of view is let them drive the conversation. If you're navigating into territory that's unfamiliar, back up how specific. I know your questions have to be specific, especially in the ER, but if there's a way you can back up from the specificness of it and let them drive what they want to tell you until you get to that comfort level, even regardless of being transgender or not, I think is a good practice. But
yeah. If you ask a transgender woman that the last time you had a menstrual cycle, they're probably going to jump up and hug you. Because that means that you fully accepted us as a female. I think the turning point for me with my spouse and I, she did struggle with it. We're separated. She has issues of being married to another woman. Still cares deeply for me. I care deeply for her as well. But the past weekend, we went out to a winery. And we were well into the first bottle. And she leaned over to me and she goes, I think I'm starting my period. Do you have a tampon? I just looked at her and started laughing. I said, ironically, I do. And I gave her my purse, and she went in the bathroom, and she came back, and she put the purse back down on the table, and she looked at me and goes, why in the hell do you have a tampon? So for her to accept me as a woman and to ask me that question, it was just another reassuring that I don't want to say I'm pulling this off, but that everyone is accepting me for who I am, and I'm actually presenting well as a female. So.
It's a safe zone, right?
Yes. I'm sorry.
why did you have a tampon?
Oh, why did I have a tampon? There was, I have 2 or 3 chat groups on Facebook, and one of the groups is to help older transgender women transition. You know, the stuff that the girls learned in their teens, how to put on makeup, how to do their hair, how to walk like a girl, how to talk like a girl, how to your posture and everything. These were all things that, as an older transgender person, we never learned, so we are almost expected if we're going to, again, pull off the presentation of being female. But one of the tricks was, hey, get a tampon and put it in your purse, because eventually someone's going to look through your purse or whatnot, and if you got a tampon in there, they're just going to naturally assume you're a female.
Every
So.
time I present with Karen, I learn something new, right? That's something you never think about. Something you never think about. Thank you, Karen.
So,
Please.
Hi, so I'm registration, I'm not nursing staff, so my question is, usually we sit at the front of the ER when somebody first walks in. How do we ask if you are, especially if it's a new patient, if it's somebody who has been there, it's already listed as male or female in the computer, which is another question too, if you're transitioning, how do we know when to change it, or how do we ask, do you want to be male or female? And it's uncomfortable to.
you just asked this. You just answered your own question. If you pull up their name, their social security number, and however you got them in the system, and it shows, hey, this is a male, but this person presenting a female, or vice versa, there's going to be something of an issue there. So you can ask them. You can give them your pronouns that you prefer, and ask them which pronouns do they use for themselves. If they say, she, her, you're going to know that you're probably going to want to change that M to an F, or at least make an annotation that they're transgender. You can then ask them if they are transitioning. It could be a touchy subject for some people who are transitioning, but for most people, if they've been to the ER before and they know that you've got them in a system as a male, and I'm presenting as a female, the simple answer for them is going to be yes. Okay, and that's all you need to do. You don't need to dig further into it. You can make that note in the records that it's transgender female transitioning. There's a difference between being transgender and not transitioning. My oldest child, Cass, assigned female at birth, is non-binary. Cass is taking testosterone. Cass is not wanting to transition to male. Cass just wants to get rid of the monthly meds. So they may not be transitioning, but they may still be on HRT. So you may want to ask a question about that as well, if they are on HRT.
At the last session, because we were talking about the driver's license, and when the driver's license has to get entered, and then on the tracking board it goes in under whatever the driver's license get entered as, but that's where you can then use your comment section. You can put the pronouns in the comment section. That would trigger a conversation between registration and nursing. And also, sometimes if you have somebody that wants to be called a different name, you can put that in the comment section. That might trigger a conversation between registration and nursing, so that we're all kind of on the same page.
Yes.
I will say the pronoun thing is pretty uncomfortable when you're first stepping into it. Once you get used to it, it's going to go one of two ways. You're going to have someone in front of you who has no idea what you're talking about and doesn't know why you're offering your pronouns. And then you're going to get someone who may or may not be presenting in one way or another, but you're going to trigger in them in a good way that you understand you're asking for that clarity, and that to me automatically steps into a more welcoming place. But you have to get to that point where you make it habit for yourself to just introduce yourself. And I did it again. I try to start presentations with, my name's Annalise, I'm the Executive Director of Quality Toledo. My pronouns are she, her, hers. And obviously I didn't do it today, so bad example. But once it becomes part of your vocabulary, you're really not going to notice that uncomfortableness anymore. It becomes habit, just like asking for their age or asking for any other piece of information that you're taking in that moment while they're checking in with you.
Yes.
Is it considered rude or inappropriate, like when you're doing your assessment, to ask them how they identify? Like, do you identify as a male or female? Is that offensive?
I wouldn't find it offensive, but some transgender people might. The use of, again, it's starting to turn with the younger crowd. What gender do you identify with? They take that as something of an insult. I don't identify, I am, okay? They take the word identify as the word assume. So I would say probably with someone who's 30 or younger, avoid that word. Someone who's older, they probably wouldn't have an issue with it. But you might want to get used to, because a lot of the younger crowd you're going to be seeing, so you might want to get used to not using, identify. What gender do you identify with? It tends to upset, it annoys Cass immensely. Cass prefers they, them, and their, but will accept he, him, and his. If you call Cass by any female reference, you're going to need to get a straight jacket. Cass will get upset and give you a lecture for it. Most transgender people who are vocal will do that.
So how do you ask the question then so it's not so?
By
Do you
just,
ask her for pronouns? Like,
yes,
you are-
just, hi, I'm Karen. I'm not a doctor. My pronouns are she, her, and hers. What pronouns do you use? It's, what pronouns do you use? They will tell you.
What if some of them, I mean, there's some females that come in that dress as male that I wouldn't even take a second question and, you know.
But by asking, you're opening that door to let
Yes.
them tell you, because you're gonna get very, I mean, I get that, I get mistaken for male all the time.
Yeah.
Especially here in Ohio.
You know,
It's the biggest thing ever.
Not, yeah.
I got yelled at in a dressing room because my wife wanted me some pair of pants. She was trying on or something. Excuse me, sir, you can't go in there. What? Okay. So again, end of story. It's not that important, but by asking that pronoun question, you alleviate, because you may get a very masculine-looking female that goes by she, her, hers. That goes by this.
If you just ask everybody that,
Just asking.
yeah.
Just asking the pronoun thing. And I'm going to tell you 100%, I can see it on your faces, yes, it's uncomfortable. It's uncomfortable for us in the community to get used to.
Do you think it's more uncomfortable for us or them?
But I think it's,
For you.
That's
Okay.
what
I mean, yes.
Yeah.
We make it more than what it is
Yes.
sometimes.
Yeah.
Yeah, I know what you're saying, because this is what I was thinking, is that, I would give you an example, but it'd take too long. But I feel like this being so open-minded and, like, I know I'm gonna walk into a situation, let's say it's a man that I think is trying to look like a lady, and maybe they're not at all, and I'm gonna be like, what pronouns do you use? He's like, sir, or like, be offended that I think that he might be transgender. You know what I'm saying? Like, you're like,
Yeah,
oh,
this
you
is
just
really
got
what we
that.
got.
You're-
Or really burly women that are like completely heterosexual, like men, and you're like, oh, you just
But-
got that. Okay. Like, I don't know.
If we normalize the pronoun
If-
conversation,
Yeah.
Well, that's.
if we normalize it within your building, it won't
I'm gonna
be.
walk into I'm gonna be in someone's office.
hey, you're always going to run into that patient. It's going to be difficult.
But I think that's where everybody's coming from. Like,
Yeah.
do we do this for every single person that walks in?
Yes. If the more you say, the more you get used to saying, I'm sorry.
I'm sorry, I didn't mean, like, does the LGBT community, like, if I was in a forum, a group community, and like, just open conversation, like, and I went to a gay bar, perfect example, and I asked somebody, what pronouns do you use? Would that be like, oh, this girl knows what she's talking about, or would this be like, what does she mean? Do you know-
I just came back from a week-long conference on, exactly this type of training kind of thing, and sat at a table of people who were a good 10 to 15 years younger than me, and hey, let's all introduce ourselves. Let's say our name, our pronouns, and your favorite song right now. Right? So it's becoming normalized in the LGBTQ spaces. Absolutely.
I think it's a great education, because I don't think any of us would have used the word pronouns.
Right.
Yeah.
Right.
But a lot of the college students, it's on all of their paperwork, I've found it on name tags when they go into that kind of, to exactly those kind of conferences. So it's us, right, that has the problem. It's the older generation of people that have.
And I'll throw out some more about best practices towards the end again. But I promise you, the more you start to normalize it within yourselves, the less uncomfortable this is going to be. So let's acknowledge it's uncomfortable for you, and that's okay. I'm still in a space where it's uncomfortable for me sometimes too. I have to remember.
You don't want to offend anybody by asking these
So
questions.
you're looking, here's where I place it. And I hope this, and it might offend you, doesn't matter. You're either gonna offend a cisgendered person, or you're gonna send a transgender person away to possibly die.
I don't want to do either.
You don't wanna do either.
But what's the worst?
Well, the worst is going to happen is you're going to get a guy that's maybe a little feminine and is a little PO'd, or you're going to send someone away thinking they have no other choice. And that's where that, for me, that's where that uncomfortableness has to end.
So what bothers me is by offending that person, society we was working and live in, I can lose my job or get sued for that.
That's the thing, we're not part of the rock and roll.
That's what irritates me.
Going-
I'm afraid of losing my job.
Going to best practices,
Offending somebody.
there needs to be policies within your company
And they
that
are
protect you.
working, and they are working on the policies here. As Cindy said earlier,
So if I
they're
offend
making
somebody, I'm not gonna lose my
management
job.
do all this training. And they're in the process of changing the EMR systems to be a little bit more gender fluid.
So what are the best practices that you made mention about?
I can talk about those for sure. And as you can see from this conversation already,
Hey guys,
the number one thing that has to happen is you have to get to this normative space within yourselves, between yourselves. And it's simple things like putting your pronouns on your email signatures. It's simple things like putting your pronouns on your name tags. And making it a normalized conversation between each other first, right? That's first best practice. When you start being okay with these conversations, and my best hope whenever we do these presentations is that when we walk away, you start entering these uncomfortable conversations with each other. Because it has to happen in order to affect any change. You have to get uncomfortable first. You have to get to that negative space. You have to get to that worry that you might lose your job. You have to. That's the reality of it. So you get into those conversations, but you start normalizing some of these things like the pronouns. And when you start normalizing them within yourselves, it becomes a lot easier to bring that out to patients. Okay? So another best practice is also maybe changing your intake forms or the way you intake a patient and how you ask those questions.
Or just the vibe you give off in general. You can ask a question, but it's all about the vibe you give.
There's a lot of that too.
Yes.
I didn't know versus, oh, I'm sorry, okay, let me, you know what I mean?
You're absolutely correct. And
Since our director's sitting here, let's let
I
her,
can't imagine ever me bringing you into the office because somebody's offended because
since our
you
boss
said
is sitting here.
he, him. What's your name?
They, them. Yeah.
Yeah,
So-
I can't imagine me ever bringing you into the office.
so those.
Thank you. Thank you.
Thank you. Those intake forms or the way you intake and ask questions will start with amongst yourselves first, and then how do we change this? How do we put off the, like, we're okay with all of this. That's training for yourselves.
Is that your phone message too? Just curious.
My phone
On
message.
your phone, when you say, you've reached the desk of Cindy Zepatoski, do you add that somehow?
I have before.
Okay.
I don't on my cell phone. It's the only place I
I mean,
have right
work,
now.
I
But
guess I was thinking work phone.
yeah. I know, especially when I'm really tired. I've taught marching band for 15 years, and I've been in marching band for 25 years. And so when I'm really tired, my voice drops a few octaves, and so sometimes I know I come across a lot more masculine on the phone. So I have done that in the past, like, you know, you reach the desk of, my pronouns are, blah, blah, blah. And that, honestly, more than just being present for anyone else, that was for me to get used to the conversation. Again, I'm just at that age where now I'm working with 25-year-olds in a high school as high school teachers who are coming in using Zize Zen.
Yeah.
Or I say Latinx, but I've also heard Latinx. I don't know which way it is, right? So there's gonna be mistakes. We make mistakes on it all the time. You're never gonna know all of the changes and pronouns and words, but the way you present it to someone coming into your offices is what will be the difference. So intake forms, how you bring people in, name tags, email signatures, normalizing the conversation within your staff. Also, there was something else to that. There was a really important point to it. Policies within your building, since the boss is here. Starting to change policies so that you know and you can be affirmed that you're a little protected. And if someone files a complaint because you said, I'm he and his, what do you go by? And they get offended and file a complaint, that the policies are there to protect you. And I can't imagine that we would be called in if that wasn't already a possibility.
Reg has to have a form signed. What is it that you were instructed to ask? Because there has been an additional form.
Gender identity.
Yeah, we have a gender identity.
But don't you just give them the form and they fill it out? You don't.
Okay,
Yeah,
so
we
you don't
add-
ask them, you just say, here's another
Right,
form?
yeah.
You don't preface it with anything?
That was part of why we did this, is because they had that form and they're like,
Well, now, they just keep adding more and more forms.
Cause I worked in outpatient and ambulatory, has been doing that for years.
right.
And it's private, so you can just turn it in and then the registration updates it for you. But I don't know about ER, I thought it was.
Is our main goal here not so much as to how the pronouns, how to use the pronouns properly, but that we should just treat everyone the same, treat everyone with respect? I was wondering more about the legality of it, the male, female, when you fill out your paperwork.
I wish I.
Because they would say it has to be on your driver's license, or we can't list you that way. Is that gonna change?
I hope so.
When we list
I-
you, how do you wish to be listed? I've had where a clerk that wasn't on their driver's license, so they couldn't list them.
I can imagine that if you're looking at legality issues and billing issues and all of those, that you're going to have a spot on your forms that lists the legal, and then has maybe if we can do something better than a comment space, something underneath that will notate that it's someone who's identifying else otherwise than what's on the legal record, so that when you look at a chart, is that the right word? Chart? Yeah. You look at a chart, you're getting all the information right at the top next to their name.
Now, we do have a box like that in registration. However, that information does not move over to the face sheet for the nurses to see.
And it also doesn't move over to EMR.
Okay.
That
why?
would be something.
Why
that
not?
would be a policy change that.
Well, it's technology change, which
Yeah,
we're working on.
Gotta love it.
Yeah,
Yeah.
we have a box that states transition male to female, we do. And we are able to put that information in our system. However, it does not transfer onto the face sheet or onto the
But
system that the nurses work.
there is a spot that it does
There is
transfer
a
over.
spot.
I would say put it everywhere you possibly can until your technology catches up to be able to transfer that. And thank
Is
you
it-
for doing that.
Is there a way? Do you still do the hospital patient bans?
Mhm.
It's been so long since it's been in a hospital. Is there a way? Are the pronouns on that, or that would probably be a good place to put
Well,
it
it
too?
does, it comes up, it says M or F on it.
No, I mean,
No, I know that, I'm saying though, if someone came in and gender identified themselves as a female, but said male on their driver's license, it's gonna pop up as male on their band.
right.
It pulls
Yeah.
from whatever they're registered as.
But what I'm
You're
trying to.
asking if registration sees that they identify as a female, maybe there's some way we can put a mark on their
A
band?
symbol or something.
Yeah, on the pronouns,
Asterisk
you
that
know.
shows that-
Because usually registration's pretty good though about saying, hey, this is, they are male, they identify female, no, on the page it does say like what name they go by.
Well,
It's all about communication.
yeah, it's communication. I mean, again, like my sibling or my child, Cass, assigned female at birth, doesn't have a driver's license, has a state ID. I'm not sure what the state ID says. But if you were to I even do it, okay? If you put Cass in the system and it comes up female, and you use female terminology towards Cass, it's going to upset Cass dramatically. So just by having an MRF on the band isn't really getting the job done. You probably should consider putting the pronouns on there as well, because that will help. I mean, everybody's got to look at that band, right?
So legally, we have to use, like they said, what's on your driver's license, even name-wise. So prior to you coming out and dressing as female 24 hours a day and changing your name, I'm sure, did you change your name?
Yes.
Okay, so if your name was whatever as a male, and you, even though you dressed as female, we would still have to put on your band that your name is William, even though you may have gone by Jane. And we can't legally change that without that license. So I guess, I don't wanna offend you by going in and going, hi, Mr. Jones, and then you being like, because a lot of times registration will walk a patient back to a room, and some of them will give them a gown and change it to if they're, being seen for belly pain or whatever, and by the time I get in there, you're already in the bed, you're covered up, and depending on how you style your hair, like you said, some females, I may come in and just out of kindness and, social etiquette say, Mr. Jones, what brings you in to see me today? Not trying to be offensive, but I don't have anything else to go by before I walk into the room.
Exactly. I've actually heard that, that experience happening to quite a lot of transgender people.
And it's not because we're trying to be in a, rude, but it's just.
And yeah.
Again, this is where we have to have a good conversation
Right.
between registration and the nursing staff. And then you need to make sure anyone that walks in that room is aware.
But you also,
Sometimes it's not always feasible for us to have that conversation.
You're absolutely right.
So there should be some other way that this information is handed from us to them without, because if I'm running and I got 6 patients, I can't look for
And that's why I
nurse
said
to-
maybe if we can put something in the comment section on the board, because everybody looks at the board with every single patient.
preferred name box on the face sheet.
But I don't put the face sheet before I go into the room.
And this is something we can work on and solve outside of here, right? But Sean had a good question about abdominal pain. And we actually had this question last week too, for patients that have abdominal pain and may be male but identify as female, or however you want to, I don't remember how you phrase it.
You say your daughter has a cow, if you call her she, but that person comes into the emergency department with abdominal pain.
And still has female.
And still has female parts.
Anatomy.
It could be a uterine cyst, it could be, we have to identify
Yes.
if you're a female.
that's okay, but to try to avoid any type of female terminology, don't be using the female pronouns. Cass is fully aware that until they have a hysterectomy, they're going to have high propensity for that scenario popping up. It's one of the reasons why Cass is taking testosterone, so that it halts Cass's periods. I'm going to do it again here in a second, but I make mistakes all the time with the pronouns, okay? And I do this all the time. I talk to people all the time about pronouns. You're going to make mistakes. Don't kick yourself for it. It might offend somebody. Apologize. If you self-correct, I'm so sorry, I meant to say, that alone is more than an I'm sorry if you make that mistake. I do it constantly with Cass, especially as a writer. They have to use they, them, and their. It's like, no, it's not plural. There's one person there. So there's that conflict in my head all the time when I'm using the pronouns. In fact, I went back and forth with my beta readers. They kept circling it, saying, change this, you've got this wrong. I'm like, no, they're right. It's the pronouns that gender fluid, non-binary people use. So you're always going to make that mistake. You won't make it as much the more you use the pronouns, the more you get used to calling someone. Probably the most difficult thing about that is not seeing enough gender fluid or non-binary people, because you won't be able to practice it. So you'll make that mistake a lot, which is something I had to explain to Cass, because Cass lives on the other side of Ohio. We only see Cass maybe 4 or 5 times of the year. I had to explain it to Cass. I said, your group of friends uses the proper pronouns for you, and they use your name. They don't use your dead name. They've known you by your chosen name, Cass, not by your birth name, otherwise known as a dead name. It's harder for Mom and I, harder for your sister, because we've known you by your birth name all your life. So we've got to get used to calling you by the name that you've chosen. In order to do that, we need to interact with you more, face to face. Texting doesn't work. Okay. The more you interact with someone, you use their name, you'll retrain your brain to use that name instead of their dead name or their birth name.
What it comes down to is that in those scenarios, you might make a mistake. And then it comes down to your reaction to that mistake. Still keeping it a positive, affirming space for that person. Even if they have a negative reaction, you can't control that because you could get a negative reaction that has nothing to do with gender or transgender issues. But you're dealing with someone with acute pain and they are masculine presenting, but have female on all of their stuff that you're looking at, you have to approach that patient with the best practice you know to address whatever's going on, and there's going to be a mistake in that. Own up to it, apologize, I'm sorry, it won't happen again, but I do need to know X, Y, or Z. We need to go there so that I can help you in this moment.
If you're,
I'm sorry, go ahead.
if you're wondering about a transgender male who's assigned female at birth, if they're, this last time they had a menstrual cycle, are they pregnant, those are all legitimate questions, okay? And for the transgender community who is transgender male, they are fully aware that that is information that needs to be shared with you, okay? I believe in March or April this past year, a transgender man gave birth. Didn't know he was pregnant. Okay, so I just did it again. Had those cramps, went in, and they told him that they were pregnant. They weren't really expecting, they were a married couple, they weren't really expecting to have children. At that point, the transgender male thought that it was kind of impossible, if not extremely difficult, for them to get pregnant, but the winds of change actually blew in and changed their life for them. The baby is healthy, was born healthy and happy, and they're doing, it was the big news. It was a tabloid news for a long time in the National Enquirer or whatever, but then if you go online, you can actually read the story. I think they're from Texas, or they had the baby in Texas, but it was like the big thing, transgender male has baby.
Hold on to your question for a second because I want to kind of wrap this up and say that we would much prefer to hear a complaint or a story come to us that I was called a she when I was having this than the emails that and calls that I do get, which is I was laughed at and I left, or I heard in the hallway, go see it in room 7. Not that that's necessarily happened here,
That's what I heard
but
from our.
I would much rather hear like someone, you know, Quality Solito, I was treated for abdominal pain and they called me a he. Sorry that happened, man, but are you alive? You good? That's the worst complaint you have? Let it go. Versus like I said, the emails I do get, I have nowhere to go. I'm in acute pain. I don't know what to do. I've been laughed at 2 ERs. So I'd much rather A than B. And that's essentially what's going to happen. You'll make mistakes. I make mistakes. Karen's said it a few times now. Own up to it, apologize, let's move on, let's get you better so that you're not sitting in an ER in front of my face right now. You know?
One of the things the speakers last week brought up is that if they're treated well, the word gets around that we are the place to go.
Yes,
Absolutely.
absolutely.
As much as Cindy wants us all to get our flu shots and beat everyone else's departments about who gets the best flu shots, I think we should be the champions to be the transgender place in the city of Toledo where we've all had training, the other hospitals haven't, and the word's going to get out that we are the place to go to get the best care.
And don't think for a second, when I get those positive emails, it goes right on our website and right on our social media. And when people contact me and say, where's the best place that I can go to do this? I have that list sitting on my desk.
And it's on their website because I saw it. Well, we do have a fairly large transgender population that we serve, I think.
We do because of the endocrinology clinic.
Okay.
So.
I was actually, one of my questions
But,
was gonna
but we don't have a large population that we see in the ED because of the things that that population has experienced from our ED. And our goal is to change that. Because we are better than that, and I know we can do better.
Please, your question.
Is there any like advocacy plays, like the Harvey House and stuff? Say if we have a patient who is transgender and they're having a hard time, they don't have anywhere to go. Is there any advocacies that we could, call in, they would sit with them, or like if we discharge them, that we can tell them they can follow up with?
Have them follow up with us. We don't really run much programming. We act as a facilitator for the area. So depending on what their issue are, you don't even have to go down that road with them. Contact Annalisa at Quality Toledo, and then we have, again, I have my lists at my desk, sitting there, like, depending on who comes to us for what and who we can get them as a resource.
And we all know that it's not necessarily us that may be snickering at the nurse's station, but we are all ones that can curb it. So.
Yeah. And
Don't-
to throw, I just want to throw, don't lose your question, please. Okay, please, okay. Okay, the last couple of, to throw out, boss, last couple best practices that I brought with me today is maybe signage at your entry point that says, tell us your pronouns,
That's a good idea, really good idea.
right? Or signage all over the place that says we are transgender friendly. And don't make up those terms on your own, just Google it, because there's plenty of, I know they already exist. I've seen them in doctors' offices. I wish I could tell you what they say, I don't quite remember, but. Secondly to that is, do you have all gender bathrooms in your waiting rooms?
Gender neutral bathroom.
Gender neutral?
Ours on the floor all say transgender neutral.
Not the ER.
No, I said on all the floors do.
Yeah,
Not the ER.
So if there's a waiting room where maybe something can be changed into a gender neutral bathroom, even just having that sign on a bathroom door will tell a transgender patient.
Are they both private?
Yeah.
Why don't we just put them?
She's writing it down.
She's on. Anybody can use them.
She's on it. Good job.
And I think that just if we could get their organization's name and phone number on our discharge form that has pharmacies on one side and
Absolutely.
shelters, et cetera, on the other.
Oh, yeah, okay. And then to our,
Easy access.
no, yeah, to our resources list.
Absolutely.
What,
100%.
one other thing that I hear a lot from transgender community who go to the doctor or go to the emergency room, they get turned into a freak show. They feel like they're being turned into the freak show. Hey, there's a transgender patient in room 2, and then everybody's going in there. Okay, avoid doing that. I know that for myself, it really wouldn't bother me. Actually, I'll tell you a quick story after this. I'm very open. You can come up and ask me anything you want about being transgender, my past life, my current life. You're not going to offend me. You could ask me a million questions, and there might be one question there I'm going to tell you, I can't answer that. You're not going to offend me by it. I'm here to educate you, to make you feel comfortable, so that we can feel comfortable, so we can get the health care that we need. I've had one in the almost 3 years that I've been transitioning. I've had one bad experience. One bad experience. I drove from here to D.C. and stopped at the rest stops and was accepted wherever I went. My one bad experience blindsided me. My primary care physician of 26 years and I, who had this wonderful reputation, I would go in and see him, and we'd go scuba diving, and we would parasail, and we'd talk about our vacations and our families, and he'd want to know where I was in the Marine Corps, and wanted to go see the great things in D.C. that were pro-military and veterans memorials and stuff. 26 years, never once brought religion into it, never once gave me a bad vibe at all. I began my transitioning. I thought, I better get this in my own personal record. So I took my letter from my endocrinologist, my letter from my psychiatrist, my therapist, and I said, hey, doc, can you put these in my medical records? And we can talk about this so I can bring you on board. And I got the church talk. You're ruining your life, destroying your legacy. You're going to end up doing gay porn. You're going to ruin your whole life, your family's life. Why would you want to do this? I was like flabbergasted. I walked out of that office thinking, my God, no wonder teenage people kill themselves after confessing to the doctor they're transgender. And I was so mad. I went back and I talked to my therapist, and she's like, "What's his name? I'm going to report him to the MAA." I'm like, "I don't want to stir the pot or whatnot." Okay, I was insulted. I was humiliated, but I think I could turn this around somehow. And I went back, and the next visit I had to go to was like a month later. And I went back in there, and this time when I went in there, and they took my blood pressure and weighed me and did all the fun questions, the nurse said, "So you're transgender?" And I went, "Yeah." And she said, "I want to learn. Can you tell me what's going on?" And I went, "Yeah." And I figured this is the perfect way for me to be an advocate. I was educating his nursing staff because they were asking the questions you're asking me today. How do we accept a transgender patient? How do we do our job without insulting or hurting them? Because our doctor, our boss, won't let us take these classes. And I went, okay, well, this is how you should do things. And this is, and I would go in there for my monthly checkups or my every 3-month checkups, and there were more and more nurses that were coming in. Pretty soon I had almost a whole staff when I would go in there asking me questions. And I was like, I'm this ambassador to the transgender community and his nursing staff because he's letting his religious views keep me and his nursing staff in the dark. So when I told my therapist that, she goes, "You are an ambassador, but in the same way, you're kind of like getting revenge at him for what he did to you by teaching his staff that he won't allow them to go and learn." There are people like that out there. Gratefully, hopefully, he's the only one in the area. I've met a lot of doctors, a lot of people, nurses, and other people in the medical profession who are very accepting. Like I said, 3 years, 1 negative experience, and it completely blindsided me. It wouldn't offend me if you said, "Hey, can I bring some people in?" If you asked me that. It might another transgender person. You can stop me on the street and ask me any question. If you ask me something about the show, I may not be able to tell you. I did sign a non-disclosure agreement there, but if you wanted to ask me anything about being transgender, I'm very open, 100% open. I will let you know, answer your question the best I can. If I don't know the answer, I will get it for you, I promise. So, there was another question over here, I think, earlier.
Did you say the show aired or it hasn't?
It did air in May and June. There were, I believe, 9 episodes in total. I don't know if there's going to be a second season. I don't think my family will be in the second season. I really don't want to get too deep into it, but
it's unreality.
I was uncomfortable with the way they were portraying these transgender people on the show, and that's why I backed away. I stepped away from the contract. The show was sold to me and my family as a pretense that this is going to be more like the Jazz Jennings show, but instead of being a teenager parent dynamic, it was going to be a transgender person and their spouse dynamic. And I watched 2 of the 9 episodes, and I did not see that dynamic happening. And the people that I know watch the show are like, "We know you. We know your family. We know your spouse, and you are not like that." The way they were portraying you. So I'm glad I didn't watch all of it because it probably would have really upset me one way or another. But
So I want to say thank you to you guys for coming so much.
You're welcome.
We really appreciate it, and I think we all learned a lot. Anything else you want to say to that?
Just thank you for having us, and happy to come back anytime and continue having those uncomfortable conversations with you. But I know you guys will get it right.
I need your agendas. This is what Chris told me that you were here. Please leave them on the table here.
Okay,
On
so
your
the
way out.
introduction, when you introduce yourself, you say, "I'm Cindy Zapatowski, I'm the nursing director. My pronouns are she, her, her." Yep. That's That's it. So if I go into a patient room and I don't know because Reg hasn't told me or whatever, I just say that and then I'll know.
Yeah, so
I'll know that you're
they'll either be
Mr.
confused-
Jones.
Worst case, you'll have someone that's just confused that doesn't know what you're talking about, and it's fine, just keep moving on, right?
Right.
But then you will have someone who's like, oh yeah, my so-and-so, my pronouns are he, his, and him.
Right.
And then that conversation
I have
started.
a transgender niece and I've never heard the pronoun thing like that. I've not heard that. And we're pretty open with our
I
family.
can imagine
and-
because you're already calling